Hi, I'm Jordan. I'm an occupational therapy student.
And I'm Gabby. I'm also an occupational therapy student.
And we have the Beck Hopelessness Scale. So the intro for this is it was developed by Beck in 1974. The purpose, it's used to assess the feelings about future, loss of motivation, expectations, with higher scores indicating greater hopelessness. It's also a predictor of suicidal ideation and attempts. When would you use this kind of assessment? You want to use it on a client who is showing signs of depression or emotional distress, when assessing suicide risk or protective factors, and when a client's motivation for therapy is low. So with that being said, the population, you might use this on a variety of different populations, normally ranging from ages 17 to 80. However, it's not designed for those younger than 17. And then just some more common groups that it's used with are patients with suicidal behavior and depressed individuals.
So with this questionnaire, it's a self-report 20-item questionnaire designed to measure a person's negative expectations about their future. You can either read the question to the client, or they can do it on their own. And then you mark either true or false on each question. It usually takes about 5 to 10 minutes. And again, it can be self-administered or given verbally by a trained administrator.
Okay, now we're going to jump ahead on how to actually fill out the assessment. So Gabby has already started, and as you can see, she's ranked items 1 through 16, either true or false, and so she's going to just go ahead and continue. So she'll read item on 17.
It's very unlikely that I will get any real satisfaction in the future. I'll say false. The future seems vague and uncertain to me. False. I can look forward to more good times than bad times. True. There's no use in really trying to get anything I want because I probably won't get it. False.
Okay, now that we've watched Gabby fill out the assessment, we're going to talk about how to score it. So for all of the different items, you either are ranking them true or false, and this is where the manual will be a good reference. So for instance, on item 1, if they ranked this statement as false, they're going to get 1 point, and if they ranked it as true, they're going to get 0 points. And you work your way down to item 20. Each question is going to be different depending on if it's false or true. They may get a point for that, or they may not get a point for that. So that's where I said that you might want to reference the manual. And then once you have all of your points marked and tallied, you want to add them all together for a total lump score. So just kind of what those scores range from. If they're scoring between 0 to 3, it's kind of indication that they have none or minimal desperation or hopelessness. If they're scoring 4 to 8, it's a mild. 9 to 14 is moderate, and it means that they may not yet be in immediate danger, but they must be checked on frequently. And if they're getting 15 to 20, it's indicating that they have severe hopelessness and that they need support ASAP.
Okay, so a clinical meaning of a 0 to 3 score would mean they generally hold positive or neutral expectations about their future. There's a low concern for suicide risk from the hopelessness standpoint. A clinical meaning of a 4 to 8 score, the client has some negative expectations about the future and may indicate early depressive thought patterns, but not immediately alarming. A clinical meaning of a 9 to 14 score would strongly correlate with clinical depression. Client experiences significant pessimism and limited belief in their ability to influence their outcomes. And a clinical meaning of a 15 to 20 score would indicate the client feels intense despair, helplessness, and negative future expectations, strongly associated with severe depression and statistically linked to high suicide risk.
Okay, that is the Beck Hopelessness Scale. Thanks for watching. I can't stop it from